Welcome back to the deep dive. Today we're tackling something really important, recognizing and managing chronic pain in cats. If you've got a cat at home, you know this can be, well, incredibly difficult because they're just so good at hiding things.
They really are. The sources are unanimous on this. Cats are often called masters of dissimulation. And there's this old idea, that they're super resistant, the whole 7 lives thing.
Right.
But that hiding instinct, it's evolutionary, means that by the time we actually see clear signs of suffering, the pain might have been going on for like months
Right.
or even years.
Which is exactly why we're doing this deep dive. We want to give you a kind of shortcut, past that camouflage, help you spot the subtle behavior changes and understand the modern ways we treat this, which are often multimodal.
Yeah.
We really need a shift in mindset. The mantra has to be, if there's a known condition that could cause pain, we just have to assume pain is present until we can prove it's not.
Absolutely. Assume pain.
Okay, so let's dig into those behavioral signs. Acute pain, like from an injury, that might be obvious, maybe limping or crying out.
Right. Much clearer.
But chronic pain,
Ooh.
well, assessing that really depends almost entirely on us, the caregivers, noticing those small, gradual changes in their routine at home.
And we have to start with the biggest cause. The number one reason for long-term pain and suffering in cats, it's osteoarthritis or degenerative joint disease, OA or DJD.
Okay.
It's this silent, creeping disease. And the behavioral shifts, they often get written off by owners as just, oh, the cat's just getting old or he's become a bit grumpy.
Yeah, we hear that all the time. My cat's just grumpy now, he's older. So how do we actually tell the difference? Is it just age or is it pain?
It really comes down to looking at patterns and what they can still do versus what they choose to do. There was this expert consensus study that identified 25 specific behaviors, and they called these sufficient indicators of pain.
Sufficient.
Meaning, if you observe these behaviors consistently, the cat is in pain. That's a pretty strong statement. But importantly, no single sign is necessary. You don't need to see all 25 or even one specific one. It's about the overall picture.
Okay, so what are some of the big ones? Mobility seems key, especially with arthritis.
Definitely. It's often about what they stop doing. So a reluctance to move is a big one. Or maybe they won't climb up onto that favorite shelf anymore. They're basically choosing to avoid the movement that hurts. They might struggle jumping up, or maybe jumping down looks awkward or hesitant. You might also see them resting for much longer periods, or sleeping way more, maybe at odd times, just because moving is hard work.
And then there are those other behaviors, the ones that seem almost like counterintuitive.
Absolutely. Grooming is a major one. If they start neglecting themselves, their coat gets messy, maybe matted. That lack of grooming is a big flag. And aggression, too. A cat that used to love being petted, but now suddenly hisses or bites when you touch a certain spot. That spot probably hurts. Also, watch for less facial rubbing, what vets call frottement. That happy headbutt routine.
Sure.
If they stop doing that against you or the furniture, it can be a subtle sign that they just don't feel great overall.
Let's pause on some of those more physical signs the sources mention, things maybe only vets usually spot. What specific physical clues should we look for if we suspect pain?
They can be subtle, yeah. Look closely at the eyes. Sometimes you might see the third eyelid, the membrane nictitante sticking out a bit more than usual, especially if the cat seems generally off, maybe a bit feverish or just really lethargic. Another one is excessive drooling. Vets call it silarrhea. That often points to significant mouth or dental pain.
Wait, silarrhea. Can you break that down? What does that actually look like for someone watching their cat?
It's just excessive drooling, like noticeable persistent drool, maybe wet fur around the chin. If you see that, especially if they're also having trouble eating, you really need to think about oral pain fast. And lastly, posture. Cats in pain might adopt what we call antalgic positions. Antalgic just means pain relieving.
Okay.
So they might curl up really tightly, maybe more than usual, or sometimes they stretch their back legs out in a kind of odd straight way. They're trying to take pressure off a sore joint.
So it sounds like we're moving beyond just guessing their mood and actually interpreting their physical posture, their position. That feels much more, well, objective. And of course, there's the feline grimace scale now, right?
Yeah.
Based just on facial expressions.
Yes. The FGS is a fantastic validated tool, useful for both acute and chronic pain. It's really the combination of everything: mobility changes, grooming habits, behavior shifts, posture, facial expression, that helps us cut through that natural instinct to hide it all. Now, to treat this properly, it's helpful to understand what chronic pain is because it's not just, acute pain that's lasted a long time. We talk about adaptive versus maladaptive pain.
Okay, adaptive versus maladaptive. What's the difference?
Adaptive pain is the good kind, relatively speaking. It's your body's warning system. You touch something hot, you pull back. That's adaptive. It serves a purpose.
Right. Protects you.
Exactly. Chronic pain, though, is usually classed as maladaptive. The sources describe it as pain without apparent biological value. It's not warning you about anything useful anymore. It's become the problem itself.
How so?
It happens because of actual changes, long-term shifts in the way the pain processing systems work. The nerves, the spinal cord, the brain. They've essentially been rewired to keep signaling pain even when the original injury or inflammation might be gone or stable. So chronic pain is now really considered its own disease state.
Wow. Okay, so we're not just treating a symptom anymore. We're treating a disease of the nervous system itself. That's a pretty big shift for how you might think about your pet's condition.
It is.
But if cats are so good at hiding pain, and they often shut down in the stressful clinic environment, how do vets actually get an accurate picture of this disease state?
Yeah, that's the challenge. We often can't rely solely on what we see in the exam room. The cat might be too scared or stressed to show those subtle signs.
Right.
That's why input from the caregiver, from you watching at home, is absolutely critical. And we use validated tools to help quantify that. They're called clinical metrology instruments, or CMIs.
CMIs, like questionnaires.
Exactly. Standardized questionnaires that you, the owner, fill out based on your observations in the cat's normal environment, where they feel safe.
Are there specific ones that are particularly helpful for listeners to know about?
Yeah, there are a few good ones mentioned consistently. The Feline Musculoskeletal Pain Index, that's the FMPI. There's also the Client-Specific Outcome Measure, the CSOMF. And another one is the Montreal Instrument for Cat Arthritis Testing, or MICAT.
Okay, FMPI, CSOMF, MICAT.
These tools help us put a number, basically, on those behaviors you're seeing or not seeing at home. And something else that's incredibly useful, home video clips.
Ah, yeah.
Absolutely. Short videos of your cat just doing normal things, walking, maybe trying to jump, using stairs if you have them. The sources call this an excellent extension of the clinic exam. It shows us what the stress in the hospital might be masking.
So once those questionnaires like the FMPI or MICAT show high pain scores at home, and maybe the video confirms it, we need to think about intervention. And typically the first line of pharmacological defense, the main tool, has been the NSAIDs, right? Non-steroidal anti-inflammatories.
Yes, NSAIDs are still the most widely used primary pain relief in vet medicine. They're powerful because they target the inflammation process directly. They work by inhibiting enzymes called cyclooxygenase, or COX enzymes.
OX enzymes.
Yeah, think of it like this. There's COX-1 and COX-2. COX-2 is kind of the bad guy driving inflammation and pain. Blocking COX-2 gives us the therapeutic effects we want, the pain relief, the anti-inflammatory action.
Okay.
But then there's COX-1, that's more like the good guy. It does important jobs like protecting the stomach lining and helping maintain good blood flow to the kidneys.
So the ideal NSAID blocks the bad guy, COX-2, but leaves the good guy, COX-1, mostly alone. Is that the idea?
That's the goal, yes. More selective COX-2 inhibition is generally safer, but this whole mechanism brings up a really tough question we have to face, especially with older cats. Given the potential side effects, particularly the risk to kidneys, is it always worth using NSAID? Couldn't we just manage conservatively?
That's a huge question, especially since so many older cats do have underlying kidney issues.
It really comes down to quality of life versus risk. Untreated chronic pain isn't just unpleasant. It's a major physiological stressor. It impacts their whole system, their behavior, their happiness. So often we accept a degree of risk because the benefit of relieving that pain, letting them move comfortably again, engage with their family, enjoy life is just so significant.
Okay.
But we absolutely have to be cautious, extremely cautious. And a big reason for that caution is the unique way cats handle drugs. Their metabolism is different.
Right, you mentioned that earlier. Can you elaborate on that metabolic hurdle?
Okay, so cats have this specific deficiency in what's called glucuronidation. It's a key pathway in the liver that helps process and eliminate toxins and many drugs from the body.
Glucuronidation, okay.
They're basically missing a crucial enzyme for that process to work efficiently. And that's why some common human painkillers that rely heavily on this pathway are incredibly dangerous for them. The classic example is paracetamol or acetaminophen. It's basically poison to cats. Strictly contraindicated, can be fatal very quickly.
Wow, okay, so no human painkillers, definitely noted. Knowing that risk then, what are the go-to safest NSAID options for long-term use in cats, according to the research?
The two with the strongest evidence for long-term safety and effectiveness, especially for arthritis pain, are meloxicam and robenacoxib.
Meloxicam and robenacoxib.
Yes. And the consensus is always to use the lowest effective dosage. Find the smallest amount that keeps the cat comfortable. For meloxicam, for instance, studies now support doses like 0.01 to 0.03 milligrams per kilogram per day for OA. That's quite a bit lower than some of the initial label doses from years ago. It really underscores needing to tailor it very carefully.
Okay.
But, and this is a huge but, the major challenge we face constantly is comorbidities. Other diseases happening at the same time. The sources highlight that up to maybe 69% of cats with arthritis might also have chronic kidney disease, CKD.
69%, that's staggering. So how on earth does a vet balance giving an NSAID for the arthritis pain without worsening the kidney disease?
It's a very delicate balancing act. In cats with stable early-stage CKD, NSAIDs can sometimes be used very, very cautiously, but they are an absolute no-go if the cat is dehydrated or has low blood volume, what we call hypovolemia or low blood pressure, hypotension.
Why is that?
Because remember, those good guy prostaglandins that COX-1 helps produce, they play a vital role in maintaining blood flow to the kidneys, especially when the body is stressed. If you block those prostaglandins with an NSAI when the kidneys are already compromised or under stress from dehydration, you risk causing acute kidney failure. It can be catastrophic.
So monitoring is key.
Absolutely non-negotiable. Close monitoring of hydration, blood pressure, and specific kidney function tests like SDMA, which can pick up changes earlier, it's essential.
Okay, so NSAIDs are a cornerstone, but as we've discussed, chronic pain is complex. It's a disease state. It fluctuates.
Yeah.
Treating it effectively rarely involves just one single thing, right? It has to be a multimodal approach.
Exactly. Multimodal is the gold standard. Combining different types of medications and non-drug therapies gives us the best chance of success and often allows us to use lower doses of drugs like NSAIDs, reducing side effect risks.
So what are some of the other key parts of that multimodal plan?
Well, one of the most exciting developments is the use of anti-NGF monoclonal antibodies. NGF stands for nerve growth factor, a key player in pain signaling. There's a specific one for cats called frinavetmab.
Monoclonal antibodies, like targeted therapy.
Precisely. It's an antibody therapy given as a simple subcutaneous injection, usually just once a month, and it specifically targets and neutralizes NGF. The guidelines now actually recommend this alongside or sometimes even before NSAIDs as a first-line treatment for cat OA pain.
Wow, a monthly injection. That sounds like a potential game changer for owners who struggle with daily pilling.
It really can be, yeah. Huge for compliance. We also use other oral meds sometimes as adjuncts, meaning in addition to other things. Gabapentin is quite common, although sedation can be a noticeable side effect for some cats.
Okay.
Amantadine is another option used in chronic pain states. And then there's nutrition therapeutic diets enriched with omega-3 fatty acids, specifically EPA and DHA. These have well-documented anti-inflammatory effects over the long term.
That makes sense. Connecting this back to the bigger picture, you mentioned the environment earlier. Pain isn't just physical, it has that emotional component too. And stress definitely makes pain feel worse, doesn't it?
Absolutely crucial point. The cat's environment directly impacts their pain perception. Negative emotions, stress, fear, they amplify pain signals. So, by making thoughtful changes to the home environment to reduce stress and make things easier physically, we can actually help decrease their overall pain experience. This is where the caregiver truly becomes part of the therapy team.
So what kind of practical, simple changes can people make at home to help a cat who's dealing with chronic pain, like from arthritis?
Think accessibility. That's the key. If you notice they stopped jumping up to that favorite window perch, remember one of those sufficient signs and put in ramps or maybe some sturdy steps. Make it easy for them again.
Right.
Elevate their food and water bowls. Just raising them a few inches off the floor can make a big difference for cats with neck or back arthritis. They don't have to bend down so far.
Simple, but makes sense.
And definitely check the litter box situation. Are the sides too high for them to step over comfortably? Switch to large boxes with a very low entry point. Eliminating that little bit of pain getting in and out multiple times a day adds up to significant relief.
It really sounds like those seemingly small adjustments, making sure they get their meds consistently, keeping a close eye on them, and adapting the home are just as vital as the medications themselves when it comes to managing this kind of hidden long-term suffering.
They are absolutely integral to success. #tag outro.
So as we wrap up this deep dive, I think the biggest takeaway is really about recognition, isn't it? Chronic cane in cats hides in plain sight. But if you learn to spot those subtle behavioral clues, maybe some of those 25 sufficient signs we talked about, and you work closely with your vet on a tailored multimodal plan, you really can make a massive difference to their quality of life.
Definitely. And remember, it's complex. Chronic pain is rarely static. It needs ongoing attention, frequent reassessment with your vet, and probably adjustments to that treatment plan over time. Always aiming for that lowest effective dose to keep them comfortable while minimizing any potential risks, especially thinking about those kidneys.
We really encourage you, maybe this week, just observe your cat with a fresh perspective. We know stress and difficulty can worsen pain perception. So are there subtle shifts you haven't noticed before? Maybe slightly less grooming? Are they not rubbing against your legs quite as much? Hesitating just a fraction before a jump? Could these be quiet signs that maybe their environment needs a small tweak, just to ease some silent discomfort? Think about providing that pain-free accessibility. It's a powerful way to provide relief.